And so the final presentation of this morning session will be presented by Dr. Michela Tinelli. She's from the London School of Economics, and she will address questions like information, quality, and safety.
Thank you so much for having me. It's a pleasure to present you some of the results we collected within a particular project, the cross-border care project led by London School of Economics, and hopefully this will bring you some information, some thoughts for discussion later in the day. We have already known and discussed a lot about the directive, and we know that this can be the ideal platform to promote collaboration between member states in relation to the provision and consumption of healthcare services. But we know that there are a few barriers that need to be addressed, in particular, for example, when we look at the lack of information for patients regarding to seek health care in another member state, but also to ensure that the care they can receive from other member states can be safe, of adequate quality, and there can be opportunity to have continuity in their care pathway. This particular project, the Cross-Border Care Collaboration Project, took place between 2010 and 2013 and informed the actual implementation of the directive in the member states. And the project was around three different key dimensions. So looked at facilitating the process whereby patients in other member states can make informed choice about to seek health care across Europe, and also to ensure that there is administrative and clinical processes that are can be obtained straightforward as possible across member states, but we can ensure continuity in the care pathway. So this particular project was a collaboration across 13 different partner institutions in Europe, across 11 member states, and as you can see, there is a magnitude of knowledge that came from the project across 14 different work packages. So it's quite difficult for me to communicate to you all the information that we gather. In particular today, I can guide you a bit through work package 5. It is looking in particular patient choice and public reporting, but everything can be easily downloaded from the website, and where we can find loads of information across different dimensions of cross-border care beyond patient choice and public reporting. This particular work package looked into 4 different dimensions. We looked into the quality measurement and management effort in European states. We looked at 6 different case studies into the quality measurement and management initiative that can be available, the variety of modes and public reporting, disclosure information across the countries. We had a second dimension looking more into the population perceptions of patient safety and quality of care, looking in particular to the Eurobarometer data. And this exercise was very useful to gather evidence around the impact of socioeconomic variables on the perception that people have on the quality and the safety of care, regard to corruption, low transparency, income inequality. These are key determinants for their perceptions. We had also an additional exercise looking into quality indicators to assess hospital quality. We are all aware of the lack of reliable standardized quality information when comparing and evaluating improvement in healthcare. So with this particular paper, was actually possible to create a yearly measure of hospital performance that can actually be used in practice, and can offer a quite precise measurement of quality trends over time, can also be an indicator for future performances. But however, we know that data must be collected in a standardized way across member states to guarantee a comparative exercise. Finally, we had also an additional dimension on patient information, need and use. And here we had an array of exercises and projects. I can present you a selection of the project just to give you a flavor of the sort of information that we gathered. This is a particular case study from Germany, has been published in EuroHealth. This special edition of the EuroHealth is a collection of case studies for the project and can be downloaded from the internet. This particular piece of work looked into what sort of information patient wants when they choose hospital, at home and abroad. There is a comparative across the two scenarios. We can see that both resident and cross-border patients want to be informed about multiple health-related aspects of their care. But interestingly, patients seems to be more worried about risk of treatment, about infection rates when they receive the care in their home country rather than when they're seeking care abroad. We could also capture that patients going abroad are more likely to seek, of course, information about financial issues from the health insurer. But we know that from the directive that health insurance from particular member states of treatment are not expected to provide such sort of information to patients when they are coming from other member states. But there is evidence that can suggest that they do so when, for their own patients, when they try to seek care abroad. From this particular case study, we could say that more effort should be made to help patients when seeking treatment in other member states, when, for example, to make contact with the healthcare providers, or also to inform the referring healthcare providers in their home country about the potential that opportunities that their patients have when moving abroad. But we know also that if a healthcare providers in a member state of treatment is used to share quality information with their patients, well, these healthcare providers are more likely to support their patient and so to provide them informed choices about the healthcare available in other member states. With this particular paper, we looked also on the GP perspective, so what sort of use they have of the public available quality information. Well, we can see that the public available quality information appear to be not so useful to GP. 90% perceive them to be invalid, unreliable, and a lot of them, again, 90% said they never really used this quality information to help their patients in the decision-making process. This is quite worrying. So GP should be more aware of the influential role that they have in the patient decision-making and should take more responsibility in guiding their patients through the array of information that are available. This is an additional paper, again looking into in a systematic way into the evidence available on how patients access and use quality information when making decisions. And it came across quite clear that patients want to access personalized information and they want to be helped and directed appropriately using a reliable external sources by their healthcare professionals. And it was clear that also more evidence is needed to map the longitudinal variation of the stages of the disease and to see whether there are different information needs according to the stage of the disease of the patients. And of course we need more standardized way and tools to allow a more comparative exercise across policy implications. We had also additional work, and this is to leave you with the last paper. This paper was around cancer care, but this can be also of use for discussion today. This paper looked at specific disease website and whether these website met patient information needs. And it appears that patients still lack the means to gain helpful information about diagnosis, about treatment, about recovery and quality of life. So these sort of websites appear not to be so useful to give the specific information that they needed. And so therefore they could be useful still, but as a complement, a supplement to what the healthcare provider might tell them. And in case this website quality improves, still is important that the care provider takes the leading role in guiding patients into the information that they need. Thank you so much.